And now all IU health doctors, nurses, and staff have to be fully vaccinated against COVID-19. Like we told you yesterday, anyone who isn't is now on a 2-week unpaid suspension. They can return after giving proof of partial or full vaccination. If workers refuse to get the shot, they will lose their job. Well, we've had thousands of student quarantines during the first few weeks of school. Now the state is offering a new incentive for districts to mandate masks. Lauren Kostick explains how this new executive order works and what doctors think about the impact on kids.
Let's start off with the basics of what this executive order says. K-12 schools with mask mandates no longer need to quarantine close contacts as long as they were masked up and don't have symptoms. Keep in mind this only applies in classroom settings, not for extracurriculars or sports. The hope is this new order serves as an incentive for districts to mask up and keep quarantine numbers down.
In order to help bring down the positive numbers and in order to bring down the number of kids who need to be put in quarantine, this is a really effective way to get there.
Because masks work. Dr. Brian Dixon with the Regenstrief Institute says the proof is in the data.
It dramatically reduces the number of exposures and the number of infections. And so this really is the best strategy.
In August, almost 1 in 3 COVID cases were among adolescents, according to the Institute, something we didn't see last year.
And so that's another reason I think behind this policy is they're trying to do something to keep infections down and keep the kids safe.
Current CDC guidance for schools say anyone who is a close contact should quarantine, except for those that are fully vaccinated and aren't showing symptoms. Either way, experts say it's best to get tested.
Right now, at least one school district's already changed quarantine plans after the announcement. Avon School says it will follow the new recommendations moving forward. But if your child is currently in quarantine, you do need to wait for school guidance on when they can return. And remember, you can keep up to date with the latest quarantines at WTHR.com. And if you're hospitalized with COVID, get ready to pay a portion of that bill. A new study finds most private insurance companies are no longer going to cover all of the bill if you're being treated for COVID-19. Allison Gormley tells us what's the deal.
At the beginning of the pandemic, the Kaiser Family Foundation found most people enrolled in fully insured private health plans got their out-of-pocket costs waived if they are hospitalized with COVID-19. But with vaccines ready and available, that practice is almost phased out, according to their more recent study. Depending on your health insurance plan, out-of-pocket costs for a hospitalization could be more than $1,000.
People's out-of-pocket costs are a fraction of what it costs the system for these COVID hospitalizations that are preventable at this point.
And that means everyone ultimately pays something, whether it's through taxpayer-funded insurance to the possibility of annual premiums going up.